This morning we have two guests, and they've been buddies for 11 years. Who are they? You'll meet them coming up next on Carolina People. Good morning. Welcome to Carolina People. This morning we're at the Marina Inn at Grand Dunes, home of the 8th annual Winter Gala for the Conway Medical Center Foundation. We're focused on a vital aspect of the Conway Medical Center, the Healthreach van. And we're visiting with the Healthreach van coordinators, Janie Smith and Liz Bright. Excuse me, it's tough having two folks here on the spot. It's a big deal, and of course it's early on a Wednesday morning. Thank you all so much for coming in. How exciting.
Thanks for having us.
The Healthreach van, it's a big deal.
It's a very big deal.
11 years now. It's 11 years. It's 11 years this month, right?
11 years this month, right.
How exciting. Wow. For both of you all spending 11 years together on the same van. That's a pretty,
just the two of us.
You guys are either great friends or great enemies. Yeah, let's hope it's the former. You won't share that early on a Wednesday morning.
Don't give up our secrets. That's right.
Pretty exciting. And what about this Grand Dunes Marina Inn? Have y'all been in here before?
This is our first trip. It's pretty
Place is
spectacular.
amazing. Yeah. Did they do a valet parking on the van?
I was going to let them, but they looked a little scared,
Yeah, they
so
looked
I didn't mind. That might not be a good idea.
That would have been cool.
That
That's
would've
right.
been really
That's
good.
right. That's
Janie
right.
kind of told me I couldn't do it.
Yeah. You thought of it. So you actually drive the van.
Mm-hmm. And
Wow.
so, well, Janie does too.
We both do.
Back and forth.
You don't have to have a special CDL license or anything to drive it. Just a little, instruction and training.
But it is a pretty good sized van.
Yeah.
I mean, it's
Yeah.
bigger than a normal van. Yeah.
Right.
I understand from Jessica early in the week it was, or Phil Clayton's going to be with us later this week.
Mm-hmm.
Somebody had mentioned that it was a donation, I believe, of AVX.
Right.
AVX really stepped up to the plate and said, this is a great way. You all approached them, or somebody approached them about this tremendous need, which is, what exactly is the significance of the van? What prompted it what prompted AVX to make the donation?
Well, I think there was just such a need in the community for a van that could provide screening out there for people that perhaps didn't have transportation. Some people are a little intimidated about going in a physician office. A lot of people just really don't have the funding to go to certain medical facilities, so therefore the van kind of came out of a need in the community.
And when you all pull up at a location, do you have to go out to the folks even there, or do they come up to you? Do they know why you're there?
Mm-hmm. They come to us.
They
We
do.
send out posters to the stop that we're going to go to, and if they've already been on the van previously, then we'll call them the night before and let them know that we'll be there the next morning, so don't eat past 10 o'clock and come on out and see us.
And what all is the van capable of providing? I mean, when you mentioned screenings and talking about not eating past 10 o'clock, I mean, it must be pretty extensive.
Yeah. We do a total cholesterol panel where we break the cholesterol down into good cholesterol and bad cholesterol, triglycerides. We also do a blood sugar with that, and we do blood pressure. And then once our machines take 5 minutes to read out the information, and once we have that, we go over it with each individual patient.
Give them a copy of the results.
Great. And how much does this cost the folks?
It's free.
It's free. You're kidding.
It is
Wow.
free in healthcare. Can you believe it?
My Lord, that is tremendous. This is part of the reason why the Winter Gala here on January 26th and the big Kingston Golf Classic are so important to raise those funds. Of course, the hospital and the medical center gives, I'm sure, of their own, giving support and supporting the staff to be able to raise the funds to provide support for the Healthreach program. But
it's really important. Our main goal, too, is to help keep people out of the emergency room. So if we can address the issues that they have beforehand until they wait till it gets to the point where you have to call an ambulance or somebody's got to take them, I mean, that's a lot of money.
Yeah,
if they don't have insurance, it's got to come from somewhere. So if we can at least catch them before they get to that point and kind of refer them out to Friendship Clinic or things like that where they can get assistance, then that's helped a lot.
So many of the same folks who wouldn't come to the hospital in the first place probably don't think they need you. I mean, how do you actually, for first-timers, I know you've mentioned you'll call some of the folks that have been on the van the first time. They may see a poster there. They think, a van coming to me, I don't want to get in that. Well, what are they going to do to me in there? But I mean, how do you get them over that hump? Do y'all actually go
Well,
inside?
when we first started, we used to yell out the window, remember?
Yeah,
We yell
when
out the
you
window,
get
people
Come on
passing
in.
by.
Oh, yeah.
But a lot of it now too is in each community. There's a lot of word of mouth.
Okay.
You know, in the churches where people gather, some of their social functions. There's word of mouth. You shouldn't, be concerned that
Right.
it doesn't
Nothing to be
hurt.
scared
And
about. Yeah.
right. So.
Good.
And when somebody comes up to you, they're always encouraging family members. You've got to get up there. Come on, I'll go. It's nothing. There's nothing.
Right.
And we're not intimidating. And a lot of people with white coat syndrome, they don't have it with us. It's like coming up with family.
Nice blue sweatshirts or nice brown jackets. Yeah, that is
But,
like coming up
you
with
know,
family. Sure.
We don't act like doctors and strict office procedures and things like that, so they feel real comfortable coming up. And we don't ask them if they have a green card. We don't ask them anything. If they have insurance, if they're
There's no
locals.
lengthy paperwork they have to fill out. It's just
Wow.
real simple information that we get.
That is amazing. Are there other Healthreach vans or anything like that in the county? Is there anything like that?
Not in the
Morris
county.
had something. They had something like that, but they were charging, I think, for that
At one time, and I don't
Yeah.
even know if that's still in existence.
That is tremendous.
No.
What a great.
Yeah, it's an awesome program.
That is unbelievable. As you said, not asking anyone. So if a viewer wants to find out more, if they want to find out about the schedule, and how do you get the word out about where y'all are going to be? How far in advance do you put the posters up at locations? Is it if they wanted to call the 347-8058 number, the Conway Medical Center Foundation's number, or to go online to the website, ConwayMedicalCenter.com. That's probably good ways, but what's the best way to find out your schedule of where you're going to be? Is that just in y'all's heads, or do y'all plan that out?
They should probably call our office. No, we make our
Okay.
calendar out a month in advance.
Good, great.
And we distribute that throughout the departments in the hospital, and make it available to some of the key contact, like the front desk at the hospital.
Right,
And they can always
yeah.
call us. Our names on the website and everything. So.
That's great, Janie. How about a typical day? Let's say today's Wednesday, maybe last Tuesday, let's say, Tuesday the 8th. What would a day like that have been starting for both of y'all? Just give us a sense of the two of y'all, Tuesday the 8th.
Well, we come in fairly early. We usually try to get there, between 6 and 6:30.
To where the van is parked.
where the
To our
van is
office,
parked.
Okay,
yeah, our office.
The
Right.
day before, we've kind of pre-assembled everything that we need for that day, and then we just do like a double check that morning. We do our controls for our machines that morning. Sometimes we actually have to get under the hood on a cold morning to,
Get the van
kinda give the van a little extra kick, because it is a diesel. But I mean, we can do that too.
Yeah. Wow. Listen to that. More than just nursing. Yeah.
Yeah, it's
Nursing a vehicle as well.
extension
I
of
love it.
nursing. So,
Yeah.
and then we just kind of get prepared for the day, and we go out. Liz can tell you about our stop last.
Tuesday.
Well,
Tuesday,
Yeah. Do you
yeah.
remember where you were?
We were at Bobby's
Bobby's.
Beauty out on Cates Bay Highway, and that's off
Right.
of 701 in Conway. So we'll get there. A lot of times there's patients already waiting on us by the time
Wow.
we get there. And we pull up, we try to get there before 7:30, probably about 7:15. We should try to get there. And once we set up, it doesn't take long at all, and then they just start coming up, and we keep records on everyone. So we pull out the record, and so we can do a continuation of what they had already done.
Right.
And we just take care of it that way. And it takes them 5 minutes at the most to get back, get their screening done, then come back up front.
Right.
They wait for the results. I give them a copy of the results, and then they're on the way. And we usually try to come back every 3 months.
Every 3 months to that same
To the same
location.
stop, yeah.
Wow, that's
Yeah.
tremendous. So how many actual locations are there that the Healthreach van will travel to? Is it just that many? Maybe 60, 70, 80, or less?
What would you say? Maybe 50.
50. 'Cause
Yeah,
we see over
right.
1,000 patients a year.
Oh, come on.
No,
Yeah.
that's,
Yeah.
that's
Is
just
there-
with that. That's with our basic screenings.
Right.
That's not
Yeah.
with everything else.
Is there room for more? I mean, could you fit more people into the vans over the course of the year, or is it pretty dang crowded now? I mean, is
It gets
it
crowded in
over
some
the course of a
areas,
day?
yeah.
Let's say
Yeah.
Bobby's Beauty shop last Tuesday there off of
I'd say
701.
about 20, maybe about 20 there.
And so it would normally, if someone's coming for the first time, it would normally take about how long? Do they walk onto the van? Just give viewers a sense, since I don't think we brought any pictures. It's sitting out in front of the Grand Dunes here, the Marina Inn. But what does the van look like? I mean, how big is it?
We call
Can
Big
they-
Blue. Is it
Can it fit in
24
more than the
24
two? Okay,
feet.
24 feet. Yeah, and it's blue.
Yeah, Big
Yeah.
Blue. Yeah,
Yeah,
blue
is
and
it
white.
this blue?
Yeah, it
It
is.
has our logo on it.
Yeah, yeah.
You have, when you come in the door, you have a little waiting area and a registration.
into the door of the van.
into the
You
door
come up,
of the van.
it seats about 3 people,
Right.
and then the rest usually have to stand. I mean, it's a small area up front.
Right,
There's a space
sure.
for me to do registration, and then a small area in the back.
That's more private for the where the actual screening takes place.
Okay,
In the
sure.
back.
So there is a level of privacy,
Right,
there,
right,
clearly,
right,
for the
right.
patient coming in.
But
And
then they
as-
also have to realize, too, you're at a screening, so it's not very private. I try not to read out what the results are. I'll just point to it and say, you want this either higher or lower.
Right.
And this is what, you're still going to be in a room filled with people. So, you know, we try to keep it to
As
a point.
confidential as possible.
As we can get away
That's
with.
fantastic. The van's 11 years old. You all have been doing this together for 11
We're
years.
11 years old.
I gotta ask directly. I mean, just a little bit. Had you been thinking about nursing for a long time, Liz, or ever this opportunity to be with folks like that, or is this something?
No,
just-
I had worked in the emergency room at Conway Hospital after nursing school, and I had left and went to a doctor's office, and one of the ER physicians had called and said, they're starting this program. You need to come on over and apply for it and see what you
Right.
think about it. So,
Right. Yeah.
yeah, this has
Same-
really grown. It's
And
wonderful.
for you, Janie, is that something you've been in nursing for?
She's been
Yeah,
nursing
for a long-
forever.
Oh no, listen to that. A little
She's much older.
sparring in the van.
For a
Yeah.
pretty long time I have. I started out in the system in progressive care and intensive care.
Right.
And then as I furthered my education, I went back and did more community education programs
Right.
like cardiac rehab, diabetic education, even wellness. And so this kind of fit with some of the community education programs I'd been involved with before.
Great. Let's talk about some things that viewers could do. We got about 10 minutes, and obviously, again, for viewers that need to get off to work now or get family off to school, the 843-347-8058 number is the foundation number.
Right.
Did you say y'all have a number as well, so someone could call and find out a little bit about the schedule? What's that best number?
My number is 347-8068.
8068. So
That's-
if
and
they
that's the
dial
direct
58 or
line.
68, they will be able to find
They'll
out
find
about
us
it.
somewhere.
Healthreach van. That's great.
Somewhere.
So they could call to get an idea of the schedule. But let's go over some, or they could visit ConwayMedicalCenter.com to learn more about the van and obviously about what prompted this 11 years ago to kick it off. But about what are some things that viewers could do if they can't get to the van, if they're immobile? And I know you'll even oftentimes make special stops or do some. Is the Healthreach van also used for transporting some cancer patients? Not y'all.
No.
There is
No.
another service.
I think
that
there
the
is
medical
another
center
service that does that. No,
provides.
that's
I'm sorry,
not us.
Jessica had mentioned another way to get out to reach out to folks. But for the van itself, if someone can't get out to the van or can't get out to one of these great locations, what are some things that viewers could be doing to just take a little better care of themselves? Are there
ahead,
some
Janie.
things that they can do?
That's a tough
Should they keep smoking?
No, obviously
Okay,
no.
how about that?
No.
No,
Watch the diet,
and we
exercise.
do some follow-up calls.
Sure.
We do some education over the phone as far as follow-up and how they're progressing and everything.
Right.
And even referral. I mean, if they're bedridden or at home and they can't get out, then they probably need to get in touch with the home health agency.
Okay.
I mean, you know.
If their
Definitely
cholesterol's
put the
high,
cigarettes
yeah,
down.
Yeah.
put the cigarettes
You know.
down. What about cholesterol? Is that something that people need to be concerned about? And what is high and what and
And in our patient population, we see probably 50 to 60% that do have blood cholesterol elevations. So that is kind of the main problem we see
That's
as
a
far
big
as numbers.
right.